Hello, everybody. Good afternoon to most people. Good morning to people in Matt's part of the world, and hello wherever you happen to be. Thank you for joining us today. You may be somewhat surprised to see me here and not Louise. She sends her apologies, but she's not feeling too well today. So for those of you who don't know, my name is Adele Atkinson, and I'm a professor of practice in financial literacy and well-being with CHASM at the University of Birmingham, and also doing various other things related to financial literacy and financial inclusion. And just in case you don't know very much about CHASM, I just wanted to say a few words about CHASM as well before I introduce our speaker today. So I think it's really important for you to be aware that CHASM is actually looking at a whole range of research at asking questions around financial risk and insecurity in society. And also that our aim is really to foster financial well-being. So we're looking at policy and practice solutions based on our research and the evidence that's available. And I think that's really helpful also for us to think how Matt's work will fit into what CHASM is doing, and equally how we can feed into the work that Matt is doing. So now, please let me introduce him. So our speaker today, I'm sure you're all aware, or you would not have joined us just now, is Mathieu Despard, and he's an associate professor at the Department of Social Work in UNC Greensboro. He was also a visiting fellow at CHASM earlier this year, and it was great to have him on campus in Birmingham. He has a range of other roles as well, including faculty director and visiting scholar with the Social Policy Institute at Washington University in St. Louis. He's an adjunct assistant professor at Ken Flagler Business School in UNC Chapel Hill, and he's also a member of the Academic Research Council for the Financial Consumer Protection Bureau. And you may be aware of Matt's research. Certainly, he's done lots of relevant work in this area, but he's covering microeconomics, financial well-being, economic mobility. He works on financial inclusion, student debt. He's clearly a very busy man. He's also working on access to healthcare, employment, social policy, and has a special focus on low and moderate income households. He's going to speak to us today for around 35 to 40 minutes, and then we'll have some time for questions and answers. If you could put your questions in the chat or flag to us that you'd like to ask a question later, then we'll do our best to manage those questions before the end of the session. So we may invite you to turn your microphone on, time allowing. So with that, I'm going to hand over to Matt now. He's going to take control and share his slides with us, and we look forward to hearing your presentation, Matt.
Adele, thank you so much for such a warm introduction, and very happy to join you all this morning here in the US and your afternoon. And I'm really pleased because this was an opportunity to extend my visit a bit with CHASM. I had just a really wonderful time this summer, and I was especially excited to learn how similar CHASM's work is with the Social Policy Institute with which I'm affiliated. We do a lot of the same research, and so I'm hoping today, while the context of employment is certainly different in the US, I'm hoping to perhaps draw out some comparative observations with other countries, particularly the UK, when it comes to employment policy, with a focus on low-wage workers. So I'm in my presentation, I'm focused specifically on the role of benefits, things like health insurance and retirement, both from the public and the private sector, and what are various shortcomings, pitfalls, and risks that ultimately low-wage workers have to assume through this patchwork of public and private benefits. So for starters, a little bit of context. We have a bit of a paradox here in the US when it comes to employment. We have record low unemployment. We continue to add a large amount of jobs each month. Yet workers themselves don't feel financially secure. And the distribution of jobs in the US is such that less than half of workers are in what are considered good jobs relative to the adequacy of pay, the benefits they receive, and working conditions such as having some autonomy in choice around work schedules and work tasks. And we also see that lower income Black and Hispanic workers are much less likely to be in one of these good jobs. And they also were hit much harder by job loss during the pandemic. So we're used to, in the US, studying wages, the wage distribution, certainly entries and exits from the labor market, and that wages are the primary form of income for most US households. So it's understandable why we focus a lot of research on that. Yet, if we look at a total compensation perspective, we need to consider and include employer benefits like health insurance, but not just employer benefits, but public benefits, benefits that are offered by state and federal government. And these can be benefits that are the result of direct outlays, cash benefits, for example, or near cash benefits. But also we do an awful lot of policymaking through the tax code. So there are important tax credits, deductions, exemptions that also comprise the public benefits we offer to support workers. Some of our common benefits that employers offer, the big one here, of course, is health insurance. As you all know, we don't have the equivalent of an NHS in the US, and we depend quite a bit on employers to offer health coverage. And employers are contracting with health insurance providers to offer different types of plans to their employees. Now, something that is somewhat similar is we have mostly defined contribution plans for retirement benefits. And those are plans in which employees contribute a certain amount of their pay each month. And those amounts are then invested based on the employee's choice of investment options like mutual funds, usually mutual funds. And employers can match employees' contributions on a dollar-for-dollar basis or some sort of matching formula. We do have paid time off that's fairly common, but as I'll illustrate later in my talk, it's only certain types of paid time off that are more common. And sometimes we also offer through the workplace dental insurance. Now, less common benefits are things like help paying for childcare and help repaying student loans. So this is important. These benefits are important to look at because it comprises almost a third of total compensation. And you might wonder, wow, that's a tremendous amount of total compensation. A big driver of that is health insurance, because health insurance is incredibly expensive here in the US. And so employers are providing most of the premiums that employees need to pay for their health insurance. And so that means that almost half of the entire population has health insurance through an employer. And in terms of retirement benefits, we have shifted very dramatically over the past 40 years or so away from traditional pensions to contribution plans. And then lastly, there is no federal law mandating any form of paid leave. In terms of the public benefits, we have some what are essentially wage subsidies, such as the earned income tax credit, the Supplemental Nutrition Assistance Program allows people to purchase food, certain types of food. To a lesser degree, we help subsidize the cost of childcare and housing, which are also very, very expensive. And then there are public forms of health insurance, including more recently in the mid-2000s through the passage of the Affordable Care Act, subsidies for individuals to purchase private health insurance. And I know that sounds a little odd. So these are public subsidies to purchase private insurance. It's an odd system we have when it comes to healthcare. And then, as I mentioned, various tax deductions or exemptions. And so some of these are received by lower wage workers who have low incomes to qualify, but everyone in the workplace, regardless of income, gets certain tax deductions or exemptions. Okay, so I want to start with a less common type of benefit that's emerged, driven mostly by digital financial technology over the last, 10 years or so. And I'm calling attention to this because my colleagues and I studied these types of programs in the workplace. And so I want to review just some of our top line findings. And this is interesting because these new types of benefits through the workplace came along really driven by two factors. Number one, employers began to survey their employees about their financial well-being, and there were very alarming rates of employees that said they were financially stressed and that they could really use some help managing their finances and navigating different financial challenges along the life course. And so a marketplace began to emerge driven by technology to offer apps and platforms and extending financial products and services into the workplace. And that included some really interesting work among nonprofit organizations who had been providing in-person services like financial coaching to extend those to the workplace, usually through a remote format. So here are the different types of benefits we examined. And as you can see, some of these were purely digital. Some of them were in-person services, even if delivered remotely. So a real range of products and services, from those that are helping workers budget and manage their finances and pay bills on time, to accessing new sources of credit. So in summary, our findings across these studies were kind of ho-hum. They were kind of modest, that the net impact is that these benefits can be helpful to at least some workers, but we didn't see anything particularly dramatic. And I think we were more, encouraged by the findings with respect to accessing new forms of credit and opportunities to save. So the workplace as a financial inclusion strategy had some merit from our studies. But again, nothing dramatic in terms of reversing employees' major sources of financial stress. And on a brighter note, we do have a problem here in the US among workers and other individuals who have low credit scores, who cannot access bank loans, for example, and other lower cost forms of credit. So these workplace loans have really increased access to credit. And companies with their fintech partners were doing some really creative things around using payroll systems to encourage saving. But as a whole, as you would expect, these new types of benefits are not good substitutes if the real problem is low wages and lack of good benefits. So based on those conclusions, we began to turn our attention more to usual or common benefits through the workplace, with a focus on lower wage and frontline workers. So essential workers, people working in services and healthcare services, retail, transportation, food services, and so forth. And we see overall in the US that most workers, nearly 3/4, have access to health insurance, retirement, and paid sick leave. But in terms of paid leave, you see the access really drops when it comes to paid family leave. So we're in the US, we're generally okay with letting people stay at home if they're sick, and paying them for that time, which makes sense because we don't want them to make other people in the workplace sick. But when it comes time to needing to care for a sick family member, we're much more stingy. And we're also much more stingy when it comes to helping people pay the high cost of childcare. Now, that's overall access. You see two occupational categories of managerial and professional and service workers, and we see really, really stark disparities in access to these benefits between these two classes of workers. Now, from an equity standpoint, it should be noted that people of color, women, immigrants are disproportionately represented in service-related occupations. So this access, disparate access to benefits is one factor that's driving racial economic inequality in the US, and follows a broader pattern of occupational segregation. So in terms of these more common types of benefits, I'm going to report some findings from a couple of our studies. One was a study of US households that during the pandemic, we collected data in 5 different waves from April of 2020, so right when the pandemic, or soon after the pandemic hit, through, gosh, I want to say December of 2021. And then we have another study that we just completed where we looked specifically at frontline healthcare workers and their access to benefits. So starting with some of our COVID findings, first of all, over these waves, I'm sorry, that our last data collection point was June of 2021, not December. So we were collecting data over about a 15-month period. So over the course of that 15 months, we saw a drop in traditional wage and salary employment, and an increase in self-employment, which includes gig work, but it's not limited just to gig work. So the broader implication here is that employees became less attached to the workplace, which of course means they would have less access to important benefits like health insurance. And to draw out this distinction a bit more, we looked at differences among workers who had been furloughed versus those that were unemployed, who had been laid off during the pandemic. And as Danny and Christoph and I have discussed before, this has really important policy implications with respect to a furlough policy in the UK versus our system of unemployment insurance. So what we see is a pretty clear pattern of workers who, in both groups of workers, are out of work. The difference being that those who are furloughed are still on a company's payroll and still have access to benefits. And we see a pretty dramatic difference between these two groups in terms of their financial insecurity, as measured by whether they skip certain essential payments like rent, or if they used alternative financial services such as check cashing, pawn shops, and payday loans. The other broad implication is that job recovery in our sample has been much lower among the unemployed versus furloughed. And I mean, that intuitively, that makes sense, because if you're furloughed at a certain point, you're called back to work. And so just in terms of the employment status of being either employed or not employed, it's much better to have been furloughed than laid off in terms of job recovery, employment recovery, more specifically. Now, looking at one of these benefits specifically, paid sick leave, which of course was a very relevant benefit to look at during COVID. At the very start of the pandemic, almost a third of our sample had no paid sick leave, so a little bit under the national average. And so you can see one of the possible consequences of a lack of paid sick leave with respect to higher rates of hardship among those who had no paid leave versus those that did. So it seems to make a pretty meaningful difference whether you're getting paid for the time away from the office if you come down with COVID, or you've been exposed and need to stay out of the workplace, versus losing pay on those days that you have to remain away from work. Now, turning attention away from the COVID study to our recent study of frontline healthcare workers, we were really interested in looking at workers such as certified nursing assistants, CNAs, home health aides, medical assistants, licensed practical nurses. So those are essential healthcare workers who are providing direct care and yet are paid much lower wages and salaries than mid-level practitioners like physician assistants, nurse practitioners, and certainly much lower than physicians and pharmacists and so forth. Now, in general, what we found was that compared to the general US workforce, some of these common benefits, these workers had much less access to, particularly with respect to paid time off and retirement. So out of the gate, we have less access to benefits among these workers compared to the general workforce. Now, looking within the sample, we saw some really dramatic disparities that showed us that workers that had college degrees and were, for example, working as a registered nurse with a college degree, they had a much greater probability of having access to major benefits like health, insurance, and retirement than those without college degrees. So we see another form of occupational segregation occurring through the healthcare workforce. And we also in this study looked not just at access to benefits, but a range of different financial difficulties, things like having trouble paying rent or experiencing food insufficiency. And for 9 out of 10 of these financial difficulties, Black workers, those without college degrees, and those working in home health or private duty settings had higher rates. And on that last point concerning home health or private duty, the comparison, the reference group there are workers in hospitals and other facility-based settings. So in the US, we have a real, in general, we have a big distinction in terms of benefits between large and small employers, with larger employers offering much more benefit access. And within healthcare more specifically, we see a big difference. If you're a CNA working in a hospital, you're better off in terms of access to benefits than if you're working in a small home health agency or you're offering private duty in people's homes. Now, I think more interestingly is we looked at the relationship of the number of major benefits that workers had access to and the probability of various financial difficulties. Now, these results in this table are predicted probabilities. So we are controlling for age, race, gender, income, and other household and worker characteristics. And so you can see that for all of these benefits, there was a statistically significant relationship between the, excuse me, I should say for all of these financial difficulties, all 10 of them, there was a significant relationship between the number of benefits one has and the probability of experiencing difficulties. And the pattern that you see, of course, is that the more benefits you have, the lower the probability of experiencing financial difficulty. A different way to look at this same relationship is when we asked workers questions to assess subjective financial well-being. Are you living comfortably versus are you struggling to make ends meet? That as the number of benefits rose, so rose their subjective financial well-being. And again, that was based on multivariate analysis, so we're controlling for income and other factors here. So there seems to be something about benefits independent of wages and other forms of income that influence financial well-being. Okay, then lastly, I want to end with some notes about some recent research I've been involved in looking at access to, use of different public benefits among low-wage workers. And essentially the reason why I wanted to do this research, and that was done in partnership with the U.S. Chamber of Commerce Foundation, is the truth that low-wage workers depend quite a bit on public benefits to get by. So they are supplementing their wages with things like child care subsidies and the earned income tax credit. Now, it's interesting because the discourse here in the U.S., and you'll still hear this, we passed welfare reform in the mid-1990s, which really shifted our social welfare system toward employment, pushing people into the labor force and discouraging dependence on public assistance. And as a result, today, almost 70% of public benefits go to non-elderly employed individuals. And over half of workers in the lower end of the wage distribution are receiving these different public benefits. So we didn't really design it this way in the US, but essentially what we have is a system of in-work public benefits primarily. Now, one important public benefit to mention going back to our COVID study is unemployment insurance. And we looked at the association of the receipt of unemployment insurance and different forms of hardship over the course of the pandemic. And as you can see from this chart, those rates of hardship increased pretty steadily and pretty dramatically over the course of the pandemic. Now, you might wonder why. Well, one of the key reasons is that in the US, we, for the first several months of the pandemic, we offered extended unemployment insurance benefits. So we offered additional payments through the end of July 2020. And we were also offering sporadic economic impact payments that concluded in early 2021. And so essentially what you're seeing, broadly speaking, is the erosion of these income supports over the course of the pandemic, starting with the end of the extended or added unemployment insurance payments. Now, and another dynamic that we have at the intersection of public benefits and employment are what we call benefits cliffs. And I imagine in the UK, you have some form of this. And essentially what cliffs mean is when workers or individuals lose access to important benefits because their income exceeds the eligibility limit. So for certain types of benefits, once you're $1 over that the income eligibility limit, you lose total access to that benefit. Now, for other types of benefits, such as the earned income tax credit, the value of the benefit phases out very gradually as income rises. So the earned income tax credit has a phase out rate of 21%. Compared to, for example, childcare subsidies, once you're $1 over that income limit, you lose the entire subsidy and you're faced with having to pay the market rate for childcare. And that's the same for housing subsidies as well. So these cliffs, whether they are a gradual phase out like the earned income tax credit or a very abrupt loss of benefit, can be computed in terms of effective marginal tax rates, which can vary from 17 to 65%. So to think of this differently, an effective marginal tax rate at the high end, say 65%, means that for every dollar of additional earned income, you're losing 65 cents of public benefits in terms of the value of those public benefits. So we reward work in terms of public benefits to get people into the workforce, but once you're in the workforce, we withdraw public benefits and impose an implicit set of taxes on workers. Now, to illustrate what these cliffs look like relative to increases in earned income, this chart comes from the Federal Reserve Bank of Atlanta, which is doing a lot of great analytical work on this phenomenon. Now, this top dotted line are net financial resources. So you can think of net resources as a family's break-even point. It's the point at which income covers all expenses. So that dotted line is reflective of cost of living. And you can see from the chart that, broadly speaking, before we even look at cliffs, that it takes employment income of close to $80,000 a year to hit that break-even point, after which families can actually experience net income that they can use to save, to pay down debt, and so forth. And as earnings rise, you see, generally speaking, the rise toward that break-even point, yet with particular hiccups along the way. So I want to say a little bit more about those hiccups. So you see here at about $10,000, and the reference point is Durham County, North Carolina. And what's important about that is that our public benefit rules vary from state to state. Some states are more or less generous than others. North Carolina happens to be a less generous state because we're in the southeast of the US, and the southeast in general is much less generous with its social welfare provision. Okay, so at $10,000, what happens is the family loses Medicaid. So they do not have a form of health insurance unless they can get it through their employer. Now close to $27,000 or so, they gain access to Affordable Care Act subsidies, so a different form of subsidized health insurance. And then a little bit later, at about $34,000, they lose their SNAP benefits, Supplemental Nutrition Assistance Program benefits. And you notice that there's also a health insurance coverage gap from about $10,000 up to about $27,000. So we structurally impose uninsurance on workers unless they can gain access through their employer. So this is kind of the fits and starts, the 2 steps forward, 1 step back nature of public benefit cliffs that are experienced as earnings rise. Now, there are certain public benefits where the cliffs are much harsher. As I mentioned, childcare and housing, because families are going from receiving a subsidy to suddenly having to pay the market rate for either commodity. More importantly, most families never experience these cliffs because they don't even get the subsidies to begin with. We restrict access, we ration these subsidies, where less than 1/5 of the families that are actually eligible based on their income and other factors for these subsidies actually receive them. And that's important because, again, we have big problems with the affordability of both housing and childcare here in the US. Health insurance is the other big risk factor for a risk area for households and workers. Again, that gap I illustrated between Medicaid and Affordable Care Act subsidies in states that chose not to expand their Medicaid programs, we are structurally imposing uninsurance on workers. But okay, let's suppose though that those workers, if they lose Medicaid, their employer does offer health insurance. So they can transition from Medicaid or from ACA subsidies to employer-sponsored coverage. But when they do that, they are going from $0 premiums up to an average of $128 for single coverage or $498 for family coverage. So suddenly their budget is blown up because they are paying out of pocket for just the privilege of having the health insurance. So that's, and again, I have to remember, we have a weird system here. So to explain, you're paying the premium that you pay to have health insurance is just for the privilege of having health insurance. Now, once you have it, you also have certain out-of-pocket costs, such as having to meet a deductible, such as $1,500 a month. You have to pay out of pocket $1,500 before insurance actually kicks in. And you have other goodies along the way, co-payments and co-insurance. So to conclude, I just want to offer a few kind of broad observations, what I'm pulling away from this research. So first, as a starting point, and this doesn't really enter the public discourse very much here in the US, is that the recognition that workers as total compensation are relying on the public and the private sector to achieve some measure of financial subsistence. Yet the way we are offering these benefits is done in very, very inefficiently. From the public sector, we are dropping workers off these benefits before wages can reach a living wage level when we factor in the cost of living. And that's especially true in high cost areas of the country, like our coastal cities. And then in the private sector, we're allocating benefits, we're giving benefits to all workers, but it has a regressive nature. As I illustrated with health insurance premiums. If you say, okay, for family coverage, every employee in this company pays $500 a month, that's going to take proportionally a much greater amount of lower wage workers' income than higher wage workers. So the broader implication of this is, and I'm throwing this out as just a broad question. Maybe we need here in the US a stronger public safety net, and maybe we need to let employers off the hook. Let's stop this practice of employers offering or not offering health insurance, paid leave, retirement. And when I say offering or not offering, is we have so much heterogeneity within the employment sector in the labor market in terms of which employers even offer these benefits, and the extent of the generosity of these benefits. So perhaps a more efficient way is to tell companies, look, you're going to pay higher corporate taxes, but your workers will then be supported by a common basket or bundle of public supports that can provide more stability for workers, but also gives workers more employment choices. They don't feel like, oh, I can't leave this job because the health insurance is so good. I really want to go to this other job where my talents could be better expressed and I could produce more for a company, but their health insurance isn't very good, so I'm going to stay here. And for the companies themselves, their competition for labor could be a lot more straightforward and transparent, because they're competing just on wages. They're not competing on benefits as well. All right, so I'm going to end there and open it up for any questions or comments that you all may have.
My computer did not want to unmute me. Apologies. Thank you very much, Matt. Impressive how much data you've got, and how much you've managed to collect, including during times of COVID.